Tiny tummies, big trouble understanding rotavirus. As parents, we want to protect our children from harm. It's a natural instinct to shield them from anything that could cause them pain or discomfort. We carefully buckle them into car seats, baby-proof our homes, and constantly scan for potential dangers. From covering electrical outlets to securing cabinets, we take every precaution to ensure their safety. But you know, some threats are invisible and silent, lurking in everyday places, waiting to strike our little ones. These hidden dangers can be the most concerning because they are not always easy to detect. Rotavirus is one such threat. This virus is not something you can see with the naked eye, but its impact can be significant. This common but potentially serious virus targets the digestive system, causing severe vomiting and diarrhea, especially in infants and young children. The symptoms can be quite severe and distressing. Rotavirus can be particularly frightening for new parents, as the symptoms can be alarming. The sudden onset of illness can catch parents off guard, making it a very stressful situation. Imagine your precious baby, usually so full of life, suddenly struck with relentless vomiting and diarrhea. It's a heart-wrenching sight for any parent to see their child in such discomfort. They become lethargic, refuse to eat, and their tiny bodies struggle to retain fluids. Dehydration becomes a major concern, and it can happen quickly in young children. It's a stressful experience, but understanding rotavirus is the first step in protecting your little one. Knowledge is power, and being informed can help you take the necessary steps to manage the illness effectively. This guide will equip you with the knowledge and tools to combat this invisible enemy. From understanding how the virus spreads to recognizing the symptoms early, you'll be better prepared to handle the situation. We'll delve into the sneaky ways rotavirus spreads, the telltale signs to watch out for, and most importantly, the powerful weapons we have to prevent and manage this common childhood illness. Vaccination is one of the most effective ways to protect your child from rotavirus. Remember, while rotavirus can be scary, it's usually a short-lived illness. Most children recover fully with proper care and attention. With the right information and a little preparation, you can face this challenge with confidence and help your baby bounce back to health quickly. Ensuring they stay hydrated and providing comfort can make a big difference in their recovery process. Consulting with your pediatrician is also crucial. They can provide guidance on how to manage symptoms and when to seek further medical attention. Your healthcare provider is an invaluable resource in navigating this illness. Practicing good hygiene, such as frequent hand washing and disinfecting surfaces, can help prevent the spread of rotavirus. These simple steps can protect not only your child but also other family members. By staying informed and taking proactive measures, you can feel reassured and confident in your ability to protect your child from rotavirus. Remember, you're not alone in this journey, and there are resources and support available to help you through it. The sneaky spread: how rotavirus travels. Rotavirus is a master of disguise, lurking in seemingly harmless places and spreading with incredible ease. This virus is not just any ordinary pathogen. It has evolved to be incredibly efficient at finding new hosts and spreading rapidly through communities, especially affecting young children. This microscopic troublemaker is highly contagious, primarily transmitted through what's known as the fecal-oral route. This means that the virus is shed in the feces of an infected person and can then be ingested by another person, often through contaminated hands, surfaces, or food. What does this mean for you and your baby? It means that rotavirus can be present in the stool of an infected person, even if they don't appear sick. This asymptomatic shedding makes it particularly insidious, as people can spread the virus without even knowing they are carriers. If an infected person doesn't wash their hands thoroughly after using the toilet, they can unknowingly transfer the virus to surfaces like toys, doorknobs, or even food. These contaminated objects become hotspots for the virus, waiting for the next unsuspecting victim to come into contact with them. Your curious baby, with their natural instinct to explore the world through touch, can easily pick up the virus from these surfaces. Babies are naturally inclined to touch everything around them and often put their hands in their mouths, making them particularly vulnerable to infections like rotavirus. All it takes is for them to put their little fingers in their mouth, and the virus finds its way into their system, ready to wreak havoc. Once inside, the virus targets the cells lining the intestines, leading to severe diarrhea, vomiting, and dehydration. But it's not just surfaces that pose a threat. The virus is versatile and can find multiple ways to spread. Rotavirus can also spread through the air, albeit less commonly. This airborne transmission can occur in crowded places or healthcare settings where the virus can be present in tiny droplets. When an infected person vomits, tiny droplets containing the virus can linger in the air, potentially infecting anyone who inhales them. This makes it crucial to maintain good hygiene and cleanliness, especially in places where children are present. Understanding how easily rotavirus spreads is crucial in understanding the importance of prevention. Simple measures like frequent hand washing, disinfecting surfaces, and ensuring good hygiene can go a long way in preventing the spread of this virus. By being aware of the virus's stealthy tactics, we can take proactive steps to protect our little ones from its grasp. Vaccination is another powerful tool in our arsenal, providing immunity and significantly reducing the risk of severe illness caused by rotavirus. Together, through awareness and preventive measures, we can safeguard our children from this sneaky and potentially dangerous virus. Telltale signs. Recognizing rotavirus in your baby. As parents, we are acutely attuned to our baby's cues, noticing even the slightest changes in their behavior. This heightened awareness is a powerful tool in identifying when something is amiss with your little one. This attentiveness is crucial when it comes to rotavirus, as recognizing the early signs can help you seek timely medical attention and provide appropriate care. Early intervention can make a significant difference in your baby's recovery and comfort. One of the most distinctive symptoms of rotavirus is severe vomiting. This isn't just the occasional spit-up that many babies experience, it's much more intense and persistent. Your baby, usually a happy spitter, might experience forceful vomiting that persists for hours or even days. This can be quite distressing for both the baby and the parents. This relentless vomiting can be alarming, but remember that it's the body's way of trying to expel the virus. It's a natural, albeit uncomfortable, response to the infection. Accompanying the vomiting is often severe watery diarrhea, another hallmark of rotavirus infection. This can lead to dehydration, which is a serious concern for infants. The stools are typically watery and foul-smelling, and their frequency can be alarming. You might find yourself changing diapers much more frequently than usual, which can be exhausting. You might notice your baby's diapers needing changes much more frequently than usual. This can be a clear indicator that something is not right. In addition to these gastrointestinal symptoms, rotavirus can also manifest as flu-like symptoms. This can include a range of signs that might initially be mistaken for a common cold or flu. Your baby might develop a fever, seem unusually fussy or irritable, and lose their appetite. These symptoms can make it difficult for your baby to stay hydrated and nourished. They might also appear lethargic and less playful than usual, a sign that their little bodies are battling the infection. This lack of energy can be particularly concerning for parents. It's important to remember that every baby is different, and the severity of symptoms can vary. Some babies might only show mild symptoms, while others might be more severely affected. Some babies might experience only mild symptoms, while others might become severely ill. In severe cases, hospitalization might be necessary to manage dehydration and other complications. If you suspect your baby might have rotavirus, it's always best to err on the side of caution and consult with your pediatrician. They can provide guidance on the best course of action and help ensure your baby receives the care they need. Prevention is also key. The rotavirus vaccine is highly effective in preventing severe cases of the infection. Discuss with your pediatrician about getting your baby vaccinated if they haven't been already. At home, ensure your baby stays hydrated. Offer small amounts of fluids frequently, and monitor their intake closely. Keeping your baby comfortable and hydrated is crucial during this time. Oral rehydration solutions can be particularly helpful in managing dehydration. These solutions are designed to replace lost fluids and electrolytes effectively. With proper care and attention, most babies recover from rotavirus without any long-term effects. Watching your baby gradually return to their playful self can be a huge relief. Remember, your vigilance and prompt action can make a significant difference in your baby's recovery. Trust your instincts and seek medical advice when needed. Your baby's health and well-being are always worth the extra effort. Dehydration danger, the real threat of rotavirus. While the vomiting and diarrhea caused by rotavirus are undoubtedly distressing, the real danger lies in the risk of dehydration. Babies with their tiny bodies and high water content are particularly vulnerable to dehydration, which can quickly escalate from mild to severe. When your baby vomits or experiences diarrhea, Their body loses precious fluids and electrolytes, essential minerals that regulate bodily functions. If these fluids and electrolytes aren't replaced quickly enough, dehydration sets in, potentially leading to serious complications. Recognizing the early signs of dehydration is crucial in preventing it from worsening. Look out for a decrease in wet diapers, a sign that your baby isn't urinating as frequently as usual. Their mouth might be dry, and they might cry without tears. As dehydration progresses, the soft spot on their head, known as the fontanelle, might appear sunken. You might also notice their hands and feet feeling cold and clammy. In severe cases, dehydration can lead to lethargy, rapid breathing, and even seizures. Preventing dehydration is paramount when your baby has rotavirus. We'll discuss strategies for keeping your baby hydrated and replenishing their electrolytes in a later section. Remember, prompt action is crucial in combating dehydration and ensuring your baby recovers quickly and fully.